Hello, this is Robert McMullen. I'm a psychiatrist, and I've been in practice over 35 years. I went to Georgetown Medical School and Columbia Presbyterian for psychiatry. Now, a couple of questions someone wanted me to answer is, what does a psychiatrist do, and what kinds of conditions does a psychiatrist treat? Now, nowadays, mostly psychiatrists evaluate patients for what kind of treatment they need, which is usually medication, or they wouldn't have gotten to the psychiatrist in the first place. If they start out with a therapist and there really is no need for medication, then you're not likely to end up with a psychiatrist. The psychiatrist will often offer medication if that's needed, and some of them will do some CBT, cognitive behavioral therapy. But most psychotherapy is now done by social workers and psychologists, and often they do a better job than psychiatrists because they do it all the time, so they're better at it. And it's a better use of resources. It doesn't make sense to have somebody go to 4 years of medical school and then internship and residency, and then see a patient once a week for psychotherapy, because then you've only got 40 patients you're seeing. It's much better to treat a lot of patients and get really experienced with using the medications. Now, another thing that psychiatrists do is TMS, Transcranial magnetic stimulation, and that's becoming more widely used, but still not used very often because it sounds a little unusual and it's a bit expensive, and then the psychiatrist has to have an extra room, and then he has to have a technician. It's really a lot to go through to get it started, but it's a revolution in psychiatry, so more psychiatrists should be doing this. Now, once somebody asked me once, do I ever not give people medication? And not very often. I had a nun come to see me about 10 or 15 years ago, bringing another nun about a problem. Now, the first nun told me she had seen me exactly 20 years before herself, and I had taken her off all of her medication. And I remembered her name very well, and I remembered a little bit of the history. And I searched all over for that chart. I wanted to see that chart. And I told her, this is very unusual, that I never take people off, or I almost never take people off all their medication, and I'd love to see how I did it and why I did it. And I believe she had had a couple of big depressions, and she was on a fair amount of medication, and I just felt she might not need it anymore. And I slowly took her off of everything, and she did fine up to the 20 years later. But usually the people that come to see me are people that clearly need some help with their brain chemistry. Now, what kind of conditions do psychiatrists treat? We treat just about everything. Depression, anxiety disorders, and under anxiety disorders, that includes panic disorder, where you get massive panic attacks, obsessive compulsive disorder, social phobia, where you have extreme anxiety, meeting new people and being in crowds, generalized anxiety disorder, where you worry about everything. I had an elderly man once that was just terrified about the stock market and so worried about the stock market. He said, the irony is, I don't even own any stocks. And we also treat major illnesses like schizophrenia and manic depression, which is now called bipolar 1 disorder. And then there's another disorder that's sort of in between schizophrenia and manic depression we call schizoaffective disorder. It's like halfway in between. And there's a few other disorders that we treat. and then how do psychiatrists work? Usually we try to make a diagnosis, although a diagnosis is a work in progress. Sometimes you can't make the whole decision in the first visit, that you gradually find out that this person actually has a lot of social phobia, or you gradually find out that this person has a lot of severe anxiety and worrying and really qualifies for generalized anxiety disorder. But that wasn't a major complaint of the patient because she or he has had it all their life and they thought this is just the way life is. So there's a lot of things that come up as time goes on to hone in the diagnosis or add another diagnosis to the problem. So I'm Robert McMullen, I'm a psychiatrist, and I just talked a little bit about what an evaluation with a psychiatrist entails and what psychiatrists treat.
Thank you very much.